Hello, everyone. Thank you for joining us on this episode of Coping Together. Today's session is being facilitated by myself. My name is Alan. I'm the program coordinator at the Mental Health Association of Central Florida for our Mental Health Connections program. Our guest today is Marina Daher. She's a licensed clinical social worker residing in Orlando, Florida, and is currently the social services manager and court liaison for Central Florida Behavioral Hospital. She brings with her a wealth of knowledge and experience in working with geriatric populations by providing clinical interventions to address psychosocial needs while confronting barriers to care. This work with the elderly brings me to our subject today, which is mental health in elders during COVID-19. So Marina, thank you so much for taking the time to meet with me today.
Thank you so much for having me. I am excited to be part of this conversation. Anytime I get an opportunity to talk about the elderly, I'm there. Count me in.
Mm-hmm. Yeah, I know that you've said that this is your passion, so I'm really excited to get some really useful information out to them. So just for my first question to start off, what aspects of the cultural shift that COVID-19 is having on our society, such as social distancing and quarantine, do you think are affecting the elder population more specifically than maybe other demographics?
Absolutely, right? I think that the knee-jerk answer to that question is absolutely. And specifically here in Florida, everyone comes to retire in Florida. Everyone from across the country and sometimes all over the world choose Florida as their destination to spend the rest of their days. And so that puts us in this very unique position where a large portion of our population is at this very, very high risk for COVID. And so what do we do? Are we just doomed? Are they just doomed? I don't think so. I think we can be creative with the things that are still available and kind of helping navigate through this very new experience for all of us.
So as we know, like seniors are one of the most vulnerable groups, especially for symptoms of COVID-19. They, are very vulnerable to it, and it may be something that's in the back of their minds constantly. So with that sort of anxiety and having to worry about it, how do you suggest dealing with that sort of anxiety and fear that they are feeling because of it?
It's normal. Right? I think that first normalizing those emotions perhaps is most important. It's normal to feel anxious. It's normal to be afraid, especially when the prescribed solution to the issue also can have damaging effects to your mental health, which is isolation. Research suggests that isolation is really the elderly person's worst enemy. It creates this world for those negative feelings, the depression, the anxiety, other mental health stuff that kind of pops up when they're isolated. And so we're telling them to isolate to protect themselves from COVID, while at the same time, that isolation could also have damaging effects on their well-being. So again, what do we do with that? And I don't think that there is a one-size-fits-all answer, because there's so many different variables. The spectrum of the elderly is so wide. You may have the very sprightly 85-year-old, 90-year-old who's feeling these anxieties and these fears because they're no longer able to go to the grocery store. They're no longer able to go, to their running club or their senior center because they're very active and they're feeling it in that way. And then you have on the other end of the spectrum, perhaps the elderly that are in the more assistive living settings, right? Whether it's the assisted living facility or the nursing home, or they're homebound, and those little bits of human interactions that they've had have been kind of either fragmented or impacted. So I think if I could give a generalized suggestion, I think it's really remaining in the moment. It's really easy to go into that black and white thinking in times like this of like, oh, I can't do anything anymore. I don't have access to anything anymore. When in reality, there are still things that are under your control. And what are those? And let's kind of hone in on those. We're still going to feel the stress and the anxieties and the fears that comes with COVID. But let's not forget the other side of the stuff that's still there, the good stuff that's still there. Very difficult to do, but at the same time, we're in a difficult situation. So if it wasn't difficult, then, something wouldn't necessarily be right.
I completely agree with that answer because like my grandmother, for example, she's feeling really isolated at home because she is very particular about the things she does, and she
Mhm.
likes things to go out and meet people. She's very
Yeah.
social, and having to stay at home has caused her some complications
Mhm.
because she loves going out. So kind of leading into my next question, do you have any advice for family members who are trying to help support their older loved ones with all the emotional and practical difficulties that they're dealing with right now?
Yeah, so I think, and I would even expand that to not only family members, but our communities in general, as brothers and sisters and cousins and neighbors and friends. What can we do to help our elderly, this very vulnerable population, kind of maintain that connectedness while still respecting the fact that in order to protect them, there has to be this social distance. And the frustration that families are experiencing right now are totally, again, normal. I think that the theme of today's conversation will be really kind of just normalizing those emotions. And we have to decide what we're going to do with that frustration. Are we going to get angry about it and just kind of, just complain, or are we going to choose to kind of be creative and find a way around it? And I vote choose to be creative. So some of the suggestions that I give, or that I would encourage, one, I would say don't underestimate the power of a phone call. Okay. We're in this world where texting is everything, and perhaps previously texting would suffice, but hearing the voice of a person brings a certain type of connectedness that texting misses, right? So maybe adding that, family members, friends, whoever's involved, making that a routine. Maybe it's a daily phone call to that older, person in your life, checking in on how they're doing, sharing how you're doing, sharing what you did with your day so they can maybe live a little vicariously through you. That's super simple stuff and easily implemented. Most of our elderlies have phone or access to a phone, and so that you shouldn't face too many barriers with that. And then you can kind of go into the more maybe complex, or that takes a little bit more time. If financially feasible, I've seen families get their older loved ones like iPads or tablets and really kind of just set it up for them. You purchase it, or if you have an old one lying around that you don't use anymore, grab it, load it up with pictures, with videos, read out loud a book or a short story and record it on there. Put it in a gift box with exact instructions of what they have to do, like turn on red button, insert this, click this next, so that they really don't have to worry about their ability to use the resource. They're just really kind of following the instructions on how to access the stuff that you've already put there. I think that to me is, if you're able to do something like that, that really goes a long way. And it also opens up the opportunity for FaceTiming and Zoom meetings and things like that. On the other side, it also doesn't have to be that fancy. It can be as simple as a care package. I would encourage sensory items, something that smells good, something that tastes good, something that feels good, a nice fluffy blanket or some nice slippers, a nice lotion that has, lavender scent or whatever scent your loved one likes. Things like sending puzzles, coloring books. I Target, it just comes to my mind. Target has these really cute little planting kits that are like $1. How cool would it be for that elderly person who's isolated and can't go outside to bring a little bit of the outside in, getting them a plant that they can take care of, that can kind of just keep their mind and body busy. I think that really is the most important part of it. If you're just sitting alone in a room, watching the clock and watching time go by, you're gonna find your brain going into those dark spaces very, very quickly. And it doesn't have to. And so the more engaged and the more things there are to keep the attention away from COVID, the better. And I think that that's where our communities and family members and friends and cousins and neighbors really come in. Because I think we have to take that initiative, because they may not, A, know that they need it, B, they may not want to ask for it. There may be a sense of, of loss of independence, kind of, of having to ask for that help or express that emotion. And so let's take that away from them. Let's just take the initiative to provide these things. And lastly, I think be consistent. If you say you're going to do something, do it. If you say you're going to send a care package, send the care package. If you say you're going to call. I don't think there's anything worse than saying you're going to do something and then not doing it, because that person may very well be waiting around all day looking forward to that, and then it doesn't come. And then it's just kind of, what a bummer. I think we can all kind of relate to that sense of disappointment when things like that happen.
Sure, I completely agree. And your tips are so useful because it's like so creative. And I know that, if you're a loved one and you receive something like that you weren't expecting, or even if you were expecting, it really shows that you care about that person. You have someone out there, even though you may not be able to see them as normally you would, you really feel that sense of love and care, by receiving those sorts of things. So I totally agree with that.
Yeah, and Alan, I even go as far as, I forgot to mention, if they have grandchildren, have the grandchildren, draw up, drawing party, do some drawings and send it to grandma and grandpa or great uncle, great whoever it is, make a flip book, have your kids kind of do it, because kids are home now too. Yep. Let's reel them in participating in this effort to keep our elderly connected, and making sure that they don't fall deep into the dumps of isolation. We don't want them there. We want to help, keep them uplifted and connected.
And that's really interesting, because one of our recent ones was on parenting, and now that's just another thing. Hey, the kids have nothing to do at home. Let's go make grandma's day today or something like that. So that's really helpful.
Yeah.
One thing I did want to touch a little bit more on is for the elderly who maybe are living alone or prefer living alone rather than in a sort of assisted living facility, they usually have this sort of practical things that they do in their everyday life that are been completely cut off from them, such as going grocery shopping, maybe going to the gym or things of that nature. And even when the country starts reopening a little bit more, those things are probably still not going to be viable options for them, being one of those vulnerable populations. So do you have any ideas for ways that they can work around those sorts of limitations and still be able to feel independent while actually not having to go out in public and expose themselves?
Yeah, I think that that's probably one of the most complex, right? And that would require the most creativity, and it's really going to be based on what's accessible to the person, and shifting that mindset of what does independence mean, because up until now, independence has meant that you're able to go grocery shopping, right? Independence means that you're able to go to the gym. Independence means that you're able to get in your car and go to the post office. My grandma with her Sears card, she never paid Sears card over the phone. She would go to Sears, and wait in line to pay for her credit card, and that for her was a thing. Like, it was a way to get out of the house and to interact and to kind of just be part of the community and keep going. So what do you do when that's no longer available to you? I don't think we're doomed. I think that takes a level of insight and a level of creativity from the person and from those around them. So that may mean creating your own, if you like to do yoga, creating your own yoga schedule, right? Where you may be able to connect. Maybe you're going to go to grab a book, a yoga book, and you're going to follow your own yoga instructions through the book. Now, is it going to give you a sense of connectedness? with the other people, no, you're still going to be lacking that, but keeping that body moving and interested in that brain, you're really challenging your brain to think in different ways when it's already been established for, decades and decades and decades and decades of thinking a certain way, right? So we really got to just hone in on those strengths. I would also encourage and highlight the fact that one of the greatest strengths in working with the older population is their resiliency. They are resilient. They've been on this earth for a long time, and they've probably gone through difficult things, maybe periods that resemble this, and that can be either good or bad. They went through it. They were successful. Let's go back to those skills that helped them surpass those negative emotions, the sense of helplessness and hopelessness. What worked then? Pull on those strengths to help you now. It can also conversely remind you of bad times when maybe you were confined or maybe things weren't going your way, and you may feel like you didn't do well in managing those emotions, but you did, because you're here now, and you got past it and you survived it. So really, again, strengths-based, right? Let's really just focus on the things that are available, on the ways that you can bring the outside world to you while still maintaining that physical distance. I think the Orlando Sentinel had a really good article yesterday about how, as the rules kind of go down a little bit and we're able to do more, you're still seeing the elderly population, in nursing homes and ALFs, they're not eating together, as simple as having a meal together. That's no longer an option. And they had a picture of like a grandma on a window and like the granddaughter on the other side of the window. So even things like that, which look really awkward, it may feel so strange, but that's our new normal, right? At least for now.
Right. Yeah, for sure. And then kind of thinking a little bit outside the box, which kind of brings me into my next question as well. So when I was with my grandma, she can't go grocery shopping like she used to. So I tried to come up with a way, and I would normally just go shopping for her, but she's very particular about the things she likes to buy. So we thought a little bit outside the box and used Instacart, which is like an online form of shopping and grocery shopping, which is really cool. And luckily I was there, but if I wasn't there, it would be really complicated for her to be able to navigate that, because some elderly people are not as proficient, or not to their fault, they just weren't brought up with it the same way that we probably were. So do you have any suggestions for maybe family members or elders themselves in navigating technology, since it's becoming even more useful than it already was during this pandemic, with so many working from home and things, and staying connected via technological means like Zoom, as we're using right now? Do you have any suggestions for them?
Yeah, I think that if you have a support network, it's really going to be on the support network to help navigate that process. I think it goes back to those, those detailed instructions that you're going to give them, or if you're able to be presently there helping them through it, doing that. For the ones that don't have that social support, it becomes a little more complicated. I would suggest that, calling the local grocery stores and asking them, explaining to them, hey, I'm an elderly person. I don't have the means, or I don't have a way to get to the grocery store during the allotted times that you're open for the seniors, and I don't have access to computer. What can we do? Can you help me? Is there a way to go around that? And I think that asking those questions is the most important, because this is all new to us. This is all new to our communities and our businesses. And so they are trying to figure out how they're meeting the needs of the customers as well. And so part of that is being able to ask for help. It's being able to call and say, hey, I'm in this situation. Is there anything you can do for me? And they may very well say, I'm so sorry, we don't have anything to help you right now. Call back at a later time. Or they may say, you know what, we haven't had a call like this yet, but let me see what we can do. Right? I would be very surprised if places like, Publix or even Walmart, the grocery stores that we have, if they wouldn't be willing to kind of go the extra mile considering everything that's going on. So verbalizing it, right? Being able to ask for help, being able to understand that in this particular situation, and really in no particular situation, but especially this one, asking for help is not a sign of weakness. And in fact, asking for help is a sign of strength, because you're trying to protect yourself and everyone else too, So I don't know if that completely answers the question, because it's just so complex.
Right.
But I think that just, again, using what's available to you. If you don't want to call the local grocery store, call your local senior center and see, hey, are there any initiatives that are going on that can help me? I know that lots of the senior centers have been doing grocery shopping for the elderly. And so that may be something that helps in that way, in that spectrum. Kind of just feel it out as you go. And again, always verbalize what you want, always ask. You're not going to find the resources if you don't ask for them.
Sure. And also, if these companies see the demand for it, also, they're definitely going to accommodate that, I believe. And even for Zoom, for example, I'm sure if they were to call Zoom's customer service, they would be able to help them with that as well. So I think that's a really great thing, because most people, they don't even think of asking for help. They're like, well, I can't figure this out. But like you said, it's not a sign of weakness to ask for help. It helps just as much, to do so. And bringing me into my final question for you, which is kind of related to what we do, in addition to what you guys do at Central Florida Behavioral. Many elders probably, or a lot of them, may have gone their whole life without ever thinking of seeking out mental health professional help. And maybe this pandemic might be the time for them to actually do that. And, with the Mental Health Association, we help connect clients to resources. So obviously, if you're watching this, we would love for you to give us a call and we can help you with that. But do you think that this is a good time for them to seek out services like support groups or even counseling? And do you see this as a rising need as the virus continues on?
I think there's never been a better time to ask for mental health help. I think that the mental health community has really kind of come a long way in normalizing mental health issues. We all at some point either flirt with a mental health symptom, or ourselves are diagnosed with a mental health diagnosis. So I think that that stigma has we've been slowly chipping away at it. And the more conversations we have like this, the more platforms are engaged in talking about mental health, the less that stigma becomes apparent. And so I would again refer back to reaching out to your community, right? If you know that there's you guys, Mental Health Association of Central Florida. If you're not in Florida and you're watching this, what's the Mental Health Association of where you are? Give them a call. Ask what's available. Ask if there are anything that's specifically geared towards the elderly population. And 211. 211. If you're here in Florida, if you're here in Orlando, give 211 a call. I think that's such an underutilized resource. Do they always give you what you want or what you're looking for? No, not always. But for the times that they do, it's really usually significant. And then again, going back to normalizing it. It's normal to feel that mental health burden on you right now. For everyone, not just the elderly, for every population. It's normal. And since it's normal and accepted as normal, we would treat it as you would any other kind of thing that happens, right? You break your toe, you go to the doctor, you sleep wrong and your back's messed up, you go to the chiropractor, you have diabetes, you take your insulin. If you're having mental health issues, let's connect you with the resources to kind of help maintain you, even if it's temporary, just for this period of time. Because anxiety and fear and depression and all of that stuff can be temporary too. You know, it doesn't mean that it has to be lifelong. No, it can be transitional. It can be for the now, and things will get back to normal. Whatever that normal will look like for you, only time will tell.
Right. Well, I think that was extremely well said, and I appreciate all your input on this specific topic. I know, like I've said before, but you have so much knowledge in this field, so I very much appreciate everything that you said today, and I really hope that whoever's listening was able to take away something meaningful from this conversation. So to sum up, thank you so much. All of our information for the Mental Health Association will be in the comments section below. So if you would like to check out things about us, take a look. And then also, we'll also put all the information for Central Florida Behavioral Hospital as well. So that's pretty much it. But thank you so much for meeting with me. And I think it was very much a pleasure talking to you.
Thank you so much, Alan. Absolutely. It's been a pleasure to be part of the conversation. Any chance I get to kind of share the mental health knowledge and kind of get that conversation started, being part of the dialogue, I'm here for it. So I appreciate what you're doing. I appreciate what Mental Health Association of Central Florida does for us. You guys are kind of the string that ties everything together in a lot of cases, and that is very much appreciated.
Thank you so much, Marina, and it was a pleasure. Have a wonderful day.
You too.